Good evening. Welcome to SpectraCell's Thursday night webinar program. Tonight, we are excited to bring you breast cancer, mechanisms underlying etiology and integrative protocols by Dr. Jim Roach. Slides and other available materials are located in the resource box on the left of your screen. Be sure to download our brand new breast cancer nutrient wheel. Dr. Roach has included his references along with bonus slides with additional information that are also available for download. At this time, I would like to welcome Dr. Jim Roach.
Good evening. Glad to have everyone on board tonight. It's always a pleasure to get to present to a large audience, and we have a good audience listening in, so I have lots of great information, 100 new studies to review as part of this, so you will hear some new information tonight, and I always get excited about doing that. So I'm Dr. Jim Roach, and just to let you know that I'm qualified for this, I'm double boarded in integrative medicine. I chaired the Kentucky Lung Cancer Research Board and taught review courses for ABIM exams. I have done research in cancer through the University of Kentucky Markey Cancer Center. I've written in cancer journals. I'm also an author of books in integrative health, and have spoken around the country. I've spoken in Los Angeles and Houston recently, and Florida and Connecticut, all over the country, and nothing I enjoy more than presenting. So here we go. Let's get started. So vitamin D deficiency is very, very important. We're going to strongly emphasize that point tonight. It's deficient in 78% of new breast cancer patients. Root canals are a problem. If you want to confirm that root canals are an issue, you could do a thermogram of the mouth and see if there's inflammation where that root canal is located. But 93% of patients with breast cancer may have root canals contributing to the cause of that. If it's in the first or second upper molar of the involved side, that meridian drains down to the breast, and maybe it's a channel for toxins to get into the breast. And there's some I've heard it portrayed that removal might improve outcome, but that's a consideration. Toxins, of course, are a risk factor with breast cancer. Air pollution and heavy metals are both a problem. Antibiotic use is associated with 15% higher risk. No surprise there, because, of course, antibiotics kill off the good bacteria in the intestinal tract. That weakens the intestinal lining, increasing intestinal permeability, and that allows food proteins to be absorbed before they're fully broken down amino acids. And when those food proteins get in the bloodstream, the immune system sees them, sends out antibodies. Subsequently, every time you eat that food, you have antibodies attacking. And so the inflammation triggered by that certainly is promoting also the bacteria in the intestinal tract, like cats and dogs. They eat food, they excrete toxins with increased permeability. They get on board, and then the toxins get into the breast tissue, which has a lot of fat because toxins are stored in fatty tissues especially. And also they clog up the liver, so the liver doesn't do as good a job in getting rid of estrogen. So by all those mechanisms in yeast, antibiotics are associated with yeast infections. Yeast are inflammatory, and they release toxins which further aggravate the situation. There is research suggesting that calcium channel blocker blood pressure medicines, amlodipine, for example, is in that category, is associated with a 297% higher risk for non-ductal breast cancer. But there are other studies that have not found a correlation. Angiotensin II receptor blockers have been associated with as much as a 397% increase in breast cancer in premenopausal women. So I always like to use natural blood pressure support. For example, coenzyme Q10 has been demonstrated in a meta-analysis of 8 studies to reduce blood pressure by 16/11. So that's my first choice in management of blood pressure. Insulin glargine is also associated with triple the risk of breast cancer. SSRIs, you may realize, increase risk. So there's research to suggest that Paxil may increase risk as much as 7-fold. SSRIs are bad drugs. They may double the risk of bleeding and fractures. They may quadruple aging of carotid arteries. And really any chemical that gets in the brain, I think, is problematic. The brain's so complex, intricate, delicate. So tricyclic antidepressants have doubled risk of breast cancer. Note that 20 of 46 independent studies have showed a connection of SSRIs, but only 0 out of 15 pharmaceutical company studies. So always pay attention to the source when you're looking at research. Obesity, no surprise, associated with higher breast cancer risk. Testosterone converts to estrogen in fat cells as part of the mechanism. Dense breast on imaging is one of the strongest risk factors for breast cancer. And it's easy to identify who's going to have dense breasts because the high estrogen individuals, high estrogen women, are overstimulated, more prone to being anxious, panicky, obsessive. They're very detail-oriented. And they're prone to female issues, certainly prone to autoimmune issues. So it's very easy within seconds almost to identify those patients when you meet them. Leptin, certainly associated with higher risk. Adiponectin is broadly protective. Of course, leptin and adiponectin both are produced in fat cells. And the best measure is looking at the leptin-adiponectin ratio and assessing that risk. But of course, that's only helpful if you actually check levels so that those levels are available through SpectraCell. And I strongly recommend you consider that. Prolactin is a good marker to assess. High levels of prolactin act like high levels of estrogen, associated with estrogen dominance in essence. So prolactin promotes breast cancer and bony metastases. And of course, antipsychotics increase prolactin levels, which is a concern. IGF-1 is a good marker for growth hormone. When high, it's suggestive of diabetes, promotes breast cancer growth, and promoted breast cancer metastasis. And exercise helps reduce IGF levels and reduce risk. Of course, dwarfs don't have cancer, right? So the short folks out there can feel good that their risk is a little bit reduced, perhaps associated with IGF-1. Hemoglobin A1C, diabetes is a risk factor with breast cancer and reduced overall survival. Metformin, however, has been protective with breast cancer. It's an mTOR inhibitor. We'll talk about more of that later. That protects against angiogenesis, growth of blood vessels in tumors. Insulin promotes testosterone to estrogen, so it has aromatase activity in essence in fat, and promoted breast cancer growth and reduced breast cancer survival. So you want to minimize use of insulin and try to reverse diabetes with aggressive management. You can go a long ways towards accomplishing that. So high estrogen is important, and certainly looking at a hormone profile through SpectraCell looks at several forms of estrogen. And in between times, you can consider looking at estrone sulfate. That's a storage form of estrogen. Estrone is the most aggressive form of estrogen. It hits the estrogen alpha receptors, which are the ones on the sex organs, on the breasts and other sex organs, whereas the beta estrogen receptors are on bone and on the brain as well. Thyroid disorders are highly correlated with breast cancer, at 233% higher risk in one study. And in this one study in women below 45, a remarkable 14-fold higher risk associated with thyroid disorders. However, this particular research suggested that thyroiditis might be protective. Now, a common theme tonight is going to be this next component, higher free T4 increased breast cancer risk. So I came across study after study confirming that. Let's look at the first. We'll get to that in a minute. Rotating night shifts certainly suppress melatonin. So over a long period of time, that increased breast cancer risk. Not sleeping between midnight and 2 a.m. So get to bed promptly at night. 10 o'clock is a good time. If you can, sleeping in brighter rooms disrupts melatonin as it's problematic. Yes, melatonin blocks estrogen, blocks angiogenesis. Research suggests breast cancer cell growth is inhibited by melatonin, as is breast cancer invasion, and it even appears to block breast cancer stem cells. So obesity-related breast cancer risk is reduced by melatonin, likely due to, and I didn't realize this, that melatonin may reduce body fat mass, inhibits aromatase, increased adiponectin, counteracting the impact of leptin, decreased glucose, and decreased insulin resistance as well. So oxalates are real important. I'm going to drink some water here. Yeah, I was eating spinach smoothies daily a couple of years ago and developed plantar fasciitis, and I couldn't get that plantar fasciitis to go away. And little did I realize that it was the spinach that seemed to be the biggest factor with that. A lot of my favorite foods, green tea, nuts, dark chocolate, all the foods we think of as being healthy are high in oxalates. Now, oxalates are most famous for kidney stones. 80 to 90% of kidney stones are calcium oxalate stones. But it turns out oxalates crystallize anywhere in the body. Most women over 50 have oxalates in their thyroid. In breast mammograms, radiologists have been trained to ignore oxalate crystals because they're so common. And on breast biopsy, malignant tissues always have more oxalates in them than the benign breast biopsies do. So oxalates are the pathway from homocysteine down to cysteine to glutathione. That's the transsulfuration pathway, or the CBS pathway. We also call that's the pathway that the body uses to get rid of oxalates. So if that pathway is not working, you're not getting rid of oxalates effectively, and they're building up in your system. And so vitamin B6 is the key factor there, right? And the way you know if you have enough vitamin B6 is, one, you can do SpectraCell micronutrient testing, and that gives you a clue, and you need to activate it. You need B1, B2, B3, biotin, magnesium, and zinc to activate that. But also you want to understand, what's the dream status? Are you remembering dreams every night? I want my patients remembering dreams every single night. To me, that signifies that key transsulfuration pathway that gets rid of toxins and gets rid of estrogen metabolites is working properly. And also you need B6 for conversion of glutamate, which is an excitotoxin overstimulating, into the calming, relaxing GABA, and it's involved in over 100 other different enzymes. So breast cancer prevention, carotenoids, cruciferous vegetables, onions, garlic, and lignans all factor into protection for breast cancer. When we're doing testing, all of these tests, all these SpectraCell tests, the micronutrient, cardiometabolic panel, the thyroid hormone, omega-check, MTHFR, all of those can play a role in optimizing care and preventing breast cancer. So first, let's look at the omega-3 fats and compare that to arachidonic acid, which is the villainous omega-6 inflammatory fat. So certainly how omega-3, a low harmful omega-6 ratio is favorable in prevention. Vitamin B6 in this study showed preventive effects. Folate and B12, of course, those promote the methylation pathway to generate glutathione for detoxification. Cysteine is involved in generating glutathione for detoxification. So all those have been demonstrated to be protective. So here is a SpectraCell omega-check report, and notice that that level is off. So this individual clearly needs more EPA plus DHA, and fish oil is obviously my favorite source, sometimes as much in that compared to flaxseed oil, for example. Arachidonic acid comes from animal products primarily. So limiting animal products and getting lots of omega-3 fats. There was a study actually on meta-analysis. You saw that in JAMA, Journal of American Medical Association, January 31st, which claimed there was not a cardiovascular risk protection in the 10 studies it looked at. But if you have 1,800 EPA plus DHA, the 3 studies that achieved that, all of them did show protection. So yes, omega-3 protects against that and is important in cancer because we need to keep blood thin in cancer, and this fish oil keeps the blood slippery, which is crucial because risk of heart attack and stroke are 4 times higher, risk of thrombophlebitis 10 times higher in cancer. So MTHFR, that's of course folic acid to folate. If you're homozygous on the C677T, that's associated with a 70 to 82% greater breast cancer risk. However, if you eat lots of green vegetables and get your dietary folate, if you get dietary vitamin B6 and B12, that association disappeared. So it's only really a factor, if you're eating processed foods that have folic acid in and you're not getting adequate fruits and vegetables and other sources of B vitamins on board. So this study, and it didn't specify whether it's homozygous or heterozygous, but the C677T gene mutation was associated with a 431% higher risk of distant metastases. So very, very important to address that pathway. And this is what the MTHFR report looks like through SpectraCell. So a study identified deficiencies associated with breast cancer, vitamin A, B1, B2, B12, vitamin C, and selenium, all were lower in breast cancer patients and therefore may be protective. And now we're going to focus on vitamins B6, B9, which is folate, and B12. So B6, extremely important. Reduced risk of breast cancer, so increasing plasma vitamin B6 associated with 22% reduced risk overall and a 34% reduced risk in premenopausal women. Dietary and total intakes of vitamin B6 overall associated with a 20% reduction. These studies showed breast cancer reduction, dietary of 26%. Look at that, supplemental vitamin B6 associated with a 39% reduction in breast cancer. Vitamin B2 helps modulate hormones very nicely. It blocks aromatase and 5-alpha reductase. That is, it increases testosterone, blocks estrogen, blocks dihydrotestosterone. So yes, it is protective. Folate in breast cancer, this is fascinating to me. For premenopausal women, higher dietary intake associated with reduced risk. Again, no surprise because that supports the methylation pathway to generate glutathione to help detoxify and get rid of estrogen metabolites. But look at this, higher blood folate levels may increase risk. Why would that be the case? Well, what they're really measuring is what? Folic acid. When they're measuring blood folate, it's folic acid. And if you can't convert that folic acid into the active methylfolate, then you're at higher risk, is what this is saying. For BRCA1 women, higher folic acid, folate blood levels were associated with a 220% higher risk of breast cancer. Okay, so folic acid is bad, and we need to convert that into the active folate. Folic acid induced breast cancer in mice. When breast cancer was induced in mice, they had high expression of a cancer-specific folate receptor. High folic acid in the diet promoted tumor growth via STAT3. So invasive ductal cell carcinoma, folate receptor alpha was detected in 2/3 of them, and expression was associated with a higher tumor grade, larger tumor size, high lymph node stage, angiolymphatic emboli, and negative hormone receptor cancer, and triple negative breast cancer. So folate receptor expression is harmful in cancer. And induced breast cancer in mice with high expression of a cancer-specific folate receptor, high folic acid promoted tumor growth, again, via STAT3. So invasive ductal cell carcinoma, folate receptor alpha, was detected, again, 2/3 of the time. I think we've already gone through this one. Let's go through this next one. And it's folate receptor alpha is overexpressed in triple negative breast cancer. That's associated with worse survival. So blocking folate receptors improves survival in this xenograft model in mice. So once again, looking at folate receptor alpha associated with poor prognosis in all breast cancer, and is especially enriched in triple negative breast cancer. So vitamin B12, blood levels were associated with breast cancer when alcohol was consumed and also when folic acid was particularly low. So glutamine, again, think closely about glutamine and its association with glutathione. So higher and with glutamate. So healthy breast cancer cells consumed glutamine, but they do not secrete glutamate. So providing glutamate is disruptive, promotes invasive characteristics. So invasive breast cancer cells convert glutamine to glutamate. So glutamate is always bad, it's harmful. We need to, if glutamine is converted to glutamate, we need for it to go on downstream in the calming, relaxing GABA, and of course it's vitamin B6 that helps that happen. So cancer cells avidly, according to one study, use glutamine and glucose to survive and proliferate. So that presents a dilemma because we know we need sufficient glutamine for the intestinal lining to work to prevent increased intestinal permeability. But if we have more than that amount, that appears to increase cancer growth and spread. So glutamine synthesis from glutamate was associated with larger tumor size, increased HER2 new expression in the study. In other words, glutamine doesn't also just convert to glutamate. It can go backwards into glutamine again, and both glutamate and glutamate are problematic. Glutamine promoted cancer cells via STAT3. So triple-negative breast cancer is highly dependent on glutamine for growth. In multiple cell lines, glutamine was more readily converted to glutamate, blocking conversion profoundly inhibited triple-negative breast cancer tumor growth. So in this particular case, it appears, and this is in vitro and in vivo, that with triple-negative breast cancer, that glutamate is more of a problem and glutamine maybe not a problem in that particular cancer. And that's interesting because a brand new study came out looking at estrogen in triple-negative breast cancer. So if you don't have any estrogen receptors and you have triple-negative breast cancer, 25% of the time when you give estrogen, that suppresses triple-negative breast cancer. So very fascinating. So if you have resistant triple-negative breast cancer cells and they have, say, 0 estrogen receptors on them, then there's 1 chance in 4 by giving estrogen that will improve the outcomes. So mTOR inhibition, again, blocks glutamine conversion to glutamate. So asparagine depletion reduces invasion and metastasis without affecting primary tumor growth. The bioavailability promotes metastasis in the mouse model. So, of course, asparagus is a source of asparagine. So that second study in Nature was profound when they came out that asparagine may actually promote breast cancer. So I would not actually recommend much asparagus in cancer patients. We used to feel asparagus was very protective or beneficial in cancer, but I would be cautious based on this research from Nature. So choline is protective. The lowest 25% of choline intake was significantly associated with increased breast cancer risk relative to the highest. And of course, choline is a methylator, right? So it helps with detoxification and getting rid of estrogen metabolites. Okay, so this is what we looked at previously. So with inositol, pharmacologic doses reduced motility and invasiveness of breast cancer cells, and blocking this inhibited basically metastasis. So inositol is a good thing, and the research really has been done with inositol IP6. So a number of studies showing benefit. So this research with ductal breast cancer, a pill form reduced chemotherapy side effects. A topical formulation was protective with chemotherapy and preserved quality of life. L-carnitine, of course, comes from animal products and is not in vegetables at all. Red meat has 3 times as much as white meat. So in this research, inhibition of L-carnitine eliminated invasion and lymphangiogenosis of breast cancer cells. And the comment was made that acetyl L-carnitine was not recommended to prevent chemotherapy-induced neuropathy due to possible harm. I would challenge that somewhat. I think there can be a role in this with acetyl L-carnitine, maybe in the days leading up to chemotherapy, because it's from everything I can discern in the 4 or 5 days prior to chemotherapy, if you actually rev up a cancer growth during that time frame, then chemotherapy is more effective because it goes after rapidly multiplying cells. And then you go into a fasting state 24 hours prior to chemotherapy that turns off the healthy cells so they're not impacted by chemotherapy. And then in the 24 hours after chemotherapy, you want to fast as well because chemotherapy may kill some cells and other cells are tottering or halfway dead. And so if you eat the snacks that are provided with the chemotherapy, then the cancer cells will say thank you and will be revived by that. But if you continue to fast for 24 hours, those dead cells that are halfway dead can go ahead and die. So oleic acid, and this was research that surprised me. Oleic acid's in olive oil, it's in avocados, guacamole. So let's see, 1, 2, 3, 4, 5, 6 studies that I have in relation to this. So eliminated inhibition of cancer stem cell activity in breast cancer cells. In other words, it's saying that it promotes cancer stem cell activity. Inhibited anti-tumor blocker in breast cells. In other words, promoted tumor activity. Promoted breast cancer cells, whereas omega-3 fats inhibited breast cancer cells. And oleic acid levels were more prevalent in the tumor versus benign breast biopsies. Now, this is preliminary research. This is not in stage. And oleic acid, of course, is just one component of olive oil and guacamole and so forth. So there are many other components within that. But this is enough to give me pause in terms of how we use oleic acid. And so I would be a little bit hesitant with this. Vitamin D, 125-hydroxy, inhibited glutamine stimulation of breast cells. So this may be one of the answers to the dilemma with glutamine. Maybe as long as you have enough vitamin D on board, that it's okay to give glutamine. But again, I particularly prefer dietary sources of glutamine as opposed to supplementation, except, again, in the week leading up to chemotherapy, I think that would be a time where you could consider giving glutamine to kind of build up the body to protect it from the chemotherapy. So higher blood levels of vitamin D and higher intake associated with lower breast density. Of course, vitamin D boosts testosterone, blocks estrogen, reduces estrogen, and obviously would reduce lower breast density, which, remember, is a very powerful risk factor in breast cancer. In breast cancer cells, vitamin D decreased glucose uptake, decreased cancer cell viability, reduced cancer cell migration, increased cancer cell stiffness, which is associated with reduced metastases. So this study was profound. This should have been front page headlines in the paper. If it had been a pharmaceutical, it certainly would have been. Blood levels of 60 nanograms per milliliter or higher associated with an 82% reduced risk of breast cancer. This is profound. And lower levels, so achieving a blood level of, say, 40, 45, or 30, were less protective. And this isn't the first study to show this. There are a number of other studies demonstrating the same thing, but this is the most profound one in terms of the degree of protection that was offered by this. So vitamin D, extremely important, and these upcoming studies are going to reinforce that. So if vitamin D was initiated within 6 months of diagnosis, breast cancer mortality was reduced 49%. So even when initiated after 6 months after diagnosis, the mortality rate was reduced 20%. And this was not a small study, 5,400 women in this research. Vitamin D is anti-proliferative, it's anti-inflammatory, it blocked angiogenesis, that is growth of blood vessels and tumors, blocked invasion, blocked metastasis, and deficiency increased the odds of not getting a chemotherapy complete pathologic response. Look at that, by 168%. So it absolutely augments chemotherapy based on this research in a powerful way. So women with estrogen receptor positive breast cancer on prescription aromatase inhibitors, vitamin D deficiency in that group was correlated with, look at that, 85% increased mortality. So when you're on aromatase inhibitors, be sure to maintain optimal vitamin D levels. How do you know if you have an optimal vitamin D level? It's because you are checking the vitamin D blood levels. And we don't want to know so much what vitamin D is in the bloodstream. We want to know what vitamin D is inside cells, because that's the functional aspect of vitamin D. There are a lot of other factors that influence vitamin D. There are vitamin D receptor proteins. There's vitamin D binding proteins that are a factor associated with that as well. Now, in this research, biphosphonates were associated with 54% reduction in death and 49% reduction in relapse. So I actually promote biphosphonate use in these types of scenarios. So low vitamin D, so the research keeps coming, right? Low vitamin D correlate with 88% of triple-negative breast cancers, whereas only 37% deficiency of vitamin D in non-triple negative breast cancers. Second study showed a 36% reduction for every 10 nanomoles per liter higher vitamin D. So if you get nothing else perfect, get vitamin D perfect in managing your patients. Triple negative breast cancer vitamin D compounds promoted cancer cell differentiation and inhibited cancer stem cells. So levels were 33% lower at diagnosis with progesterone receptor positive breast cancers. And after completion of breast cancer treatment, the levels dropped 16 nanograms per milliliter. So it's worthwhile to monitor vitamin D on an ongoing basis. Vitamin A is also protective. A derivative of retinoic acid in triple-negative breast cancer cells is anti-proliferative. Curcumin from turmeric, those two together were beneficial. So curcumin sensitized triple-negative breast cancer cells to vitamin A-driven cancer cell death. So this was fascinating. Progesterone increases breast cancer stem cells. And this isn't the only study, by the way, that shows that. I've seen at least 3 studies showing progesterone increasing breast cancer stem cells. So if you're using bioidentical hormones, it seems certainly that progesterone is protective. Probably in most, for example, it blocks breast tenderness, for example. So normally is inhibitory in that regard. But I have some patients when you get progesterone that it converts into estrogen, and they get more breast soreness when you get progesterone. So if you give it as a combination all-in-one cream, how do you know whether it's having that effect or not? So if you use progesterone cream, always use it separately to discern whether it's calming or relaxing like it should be, to discern that it's preventing breast tenderness, mastalgia. So vitamin A analog inhibited progesterone promotion of breast cancer stem cells. So if you use progesterone, for sure, be sure that those patients have enough vitamin A on board. So in estrogen receptor positive, HER2 new positive, and triple negative cell lines, vitamin A derivative in combination with omega-3 fatty acids promoted cancer cell death. Vitamin A derivatives have been demonstrated to inhibit migration. They can lead to metastasis. Vitamin A induced cancer cell differentiation, that is normalization, and sensitized breast cancer cells to chemotherapy. Vitamin K2 in this research showed a dramatic reduction in breast cancer cell growth. So whenever you give vitamin D, be sure to give vitamin K2, vitamin A, and vitamin E, because vitamin D in big doses suppresses all 3 of those. Of course, the patient's on Coumadin. I wouldn't do that, but otherwise I would do that. Incidentally, Coumadin has been demonstrated to protect against cancer, which is fascinating. However, there are better ways in cancer to keep the blood thin, which is extremely important. So calcium in this study increased blood levels of calcium were associated with reduced breast density, which would be favorable. Maybe that's because vitamin D and vitamin K both increase absorption of calcium. So maybe that is a demonstration that the D and K levels are good. But calcium intake more than 3 times a week was linked to 49% greater risk of breast cancer. So maybe some calcium is good and too much calcium is bad, right? Calcium promotes aromatase, conversion of testosterone to estrogen, and that's not good. Calcium's constipating, so you don't get rid of toxins, and you end up reabsorbing estrogen metabolites in the intestinal tract when you're constipated, and that's not good either. So the dose is key there with calcium. And this was surprising to me in the research that I've reviewed. So you notice these are studies. This last one was August of 2018. So breast cancer cells transport magnesium within tumor cells, promoting tumor growth. Now, dietary magnesium intake reduced breast cancer death 42%. But, there's some concern here that magnesium may be problematic. The tumors may be able to use magnesium for its own devices, but data so far is very limited. But what I can offer you is that taurine has a lot of anti-tumor research. So if you use magnesium taurate, that is a reasonable form of magnesium to consider in breast cancer. However, I think the best way to get magnesium would be Epsom salt baths, and again, through nutritional means rather than taking magnesium supplementation. Vitamin E, very important. The gamma tocopherol form of vitamin E. So the type of vitamin E is critical. Alpha tocopherol that's in multivitamins is not been demonstrated to be a benefit. So the tocotrienols absolutely have been demonstrated to be a benefit. They inhibit nuclear factor kappa beta, the master inflammation switch, all right, and they lower cholesterol effectively, and of course they thin the blood as well. So in this research, the gamma-tocotrienol suppressed metastatic breast cancer cell proliferation and suppression of the WNT-B-catenin signaling was demonstrated. Whenever you see WNT, think metastasis. So vitamin E in the tocotrienol form should reduce metastasis, and it reduces angiogenesis. So whenever there's more inflammation associated with cancer, that promotes angiogenesis, and tocotrienols are something that I use to be protective in HER2-neu scenarios associated with increased angiogenesis. So again, tocotrienols may be protective in that situation. So with selenium, inhibition of DNA damage, cell proliferation, angiogenesis, and cancer invasion, induction of cancer cell death associated with that. And this was interesting research. Again, this is 2018. 5-year survival of breast cancer was based on the blood level at initial diagnosis. If you were in the lowest 25%, survival was 68%, but if you were in the highest 25%, survival was 82% in breast cancer. So do you want to know selenium at the onset? Absolutely. Know what selenium is, and you want those blood levels to be toward the higher end of the normal range. So in the lowest to 25%, the death risk was 149% higher. And if you're a female smoker, the highest quartile was especially protective. The survival was 503% higher when there was plenty of selenium around. So alpha-lipoic acid is a positive nutrient in breast cancer. It inhibited cancer initiation and promotion, inhibited migration and invasion of breast cancer cells through inhibition of those particular markers. Alpha-lipoic acid lowers blood sugar. Tumors love blood sugar, so it's protected by that mechanism. Lactic acid, you may realize, is a promotion of cancer cell invasion by breaking down the tissues surrounding tumor cells. So alpha-lipoic is one of the things that may help inhibit lactic acid. So I measure LDH levels, lactic dehydrogenase. If those are elevated, along with using potassium bicarbonate, I may use alpha-lipoic acid in the acetylcysteine and quercetin in combination with bromelain to help neutralize the lactic acid effect. Target urine pH of the first or second specimen in the morning of 7.0 to 7.5. Coenzyme Q10, the research is sparse but promising in that it can assist in prevention and treatment of breast cancer and comorbidities. CoQ10 lowers blood sugar. It also thins out the blood, which is important in cancer and supports normal cell function by supporting mitochondria. In acetylcysteine in breast cancer induced anti-proliferative changes. It reduced Ki-67, the marker of proliferation. So glutathione, and this was concerning, inhibiting glutathione sensitized cancer stem cells during radiation therapy led to complete tumor regression. So having glutathione around at the time of radiation is not a good idea. You want glutathione levels to be low. It made me wonder whether giving Tylenol in the days leading up to radiation would be a good idea as a mechanism to deplete glutathione. So the quote was made from by this author: extraordinary opportunity for selective and efficient eradication of drug-resistant cancer stem cells. I'm not actually recommending acetaminophen, but it makes you wonder, if you can deplete glutathione immediately before radiation, how much an impact that would have. So in triple-negative breast cancer, cells, lower glutathione levels led to better response to chemotherapy. Triple-negative breast cancer patients that had increased ability to generate glutathione had poorer survival. Limiting glutathione precursors. Cysteine is the rate-limiting nutrient in making glutathione, but glutamine and glycine are also part of the picture. Limiting glutathione enhanced triple-negative breast cancer cell killing in vitro and in vivo. Now, that doesn't mean that you can't use glutathione in cancer, but I think you need to be very careful if you do use glutathione when you might use that. There might be a role for using it, for example, say 5 days prior to chemotherapy to kind of clear out toxins, but you don't want to give it close to chemotherapy because it would inhibit the effectiveness of the chemotherapy. So insulin is a negative factor in promoting breast cancer and for progression-free survival at 117% greater risk associated with that. It's a fairly specific indicator. High levels associated with 71% higher risk, elevated sugar associated with 80% higher risk, and of course body mass index associated with higher risk as well. So lipids in breast cancer, the study claimed that cholesterol and the other lipids were lower at the time of diagnosis, but interestingly, after chemotherapy, the lipids were higher, cholesterol, triglycerides, and LDL, and that's important. Remember, your risk for heart attack and stroke is about 4 times higher, and so we don't want cholesterol, triglyceride levels, or LDL levels to be higher. And so you want to look at lipids initially, and then you want to check levels periodically as a marker of, well, how well is the patient complying nutritionally with what we're doing? And there, may be times where you might want to consider red yeast extract, for example, when levels of lipids are higher, and that also would help lower hormone levels. So the LDL subfractions and the VLDL enhanced breast cancer promoted, the LDL subfraction promoted cell viability, promoted migration, as metastasis promoted angiogenesis, and VLDL promoted lung metastases. Okay. Preoperative association with prognosis, low HDL associated with 47% worse overall survival, lower triglycerides, 43% worse disease-free survival. So adiponectin, we mentioned this earlier, lower levels of adiponectin associated with breast cancer risk, so we want higher levels of adiponectin in reference to leptin. We want lower leptin levels. So homocysteine levels are higher initially in breast cancer, and when they are higher, they're associated with progression, node metastasis, HER2/neu triple negative, and non-response to chemotherapy. So again, presenting a little bit of a dilemma. Now, this does remind me, I had a prostate cancer patient, and his homocysteine was running around 22. And everything I tried to get that homocysteine down, nothing seemed to work with that. And his prostate cancer was progressing until one point it suddenly dropped. The homocysteine level did. And I asked him about that, and he said, I started going to AA. So he was alcoholic, and that was causing his high homocysteine. And when he stopped his alcohol, his prostate cancer stabilized, and he did really well after that. So fascinating story. But, when homocysteine is high, you don't want to jump in with a lot of B12 and folate supplementation, because the tumors may hijack B12 and folate toward their own purposes, but certainly you can support folate with a lot of green vegetables to get that down, and maybe small amounts, measured amounts of B12 may be beneficial there. And of course, B6, remember, helps that. So optimize, get your patients streaming every night to be sure they have plenty of B6. So I use a lot of pyridoxine 5-phosphate in my cancer patients. And remember, even vitamin B2 can help lower homocysteine some. So this thyroid issue is fascinating. So levothyroxine, once again, this is different research than what we looked at earlier. It's associated with 24% higher risk of breast cancer, and if used for over a year, 26% higher risk than 45% higher risk if you're over 64. See a higher total T4 associated with higher risk and premenopause. Maybe we did look at these studies earlier, but it just reinforces what we were saying about thyroid. Yeah, I think that looks familiar. We looked at that as well. So thyroid peroxidase antibodies, the presence of antibodies is associated with higher risk of breast cancer in a meta-analysis. So that's contrary to another study that we looked at earlier. So the antibodies, it's not real clear-cut what the impact of that is, but the risk of metastasis could be lower when the antibodies are present. So that was an interesting factor. Hormones, physical activity, reduced total and free estradiol, reduced free testosterone, reduced DHEA sulfate, and sex hormone binding globulin. So all of those are favorable things. So physical activity is as effective or more effective than chemotherapy in breast cancer. Okay, so you need your patients out there walking. How fast should they walk? They should be walking at a clip where they can get one sentence out, but not two sentences consecutively out. So you want them breathing so hard that they can only get one sentence out. That's how fast you want them to walk. And I would like 45 minutes up to an hour a day of that pace of walking, I think would be very helpful. So increasing sex hormone binding globulin assures that the liver is working properly to produce that SHBG to help bind up the excess estrogen. That's why that is favorable. So the top quartile of estradiol increased estrogen receptor positive breast cancer 264%. So estrogen is a very definite risk factor. And look at this. Estrogen is a major breast stimulus. Estrogen stimulates progesterone expression. Progesterone stimulates prolactin expression. Progesterone and prolactin stimulate cancer markers GAK, MAPK, and STAT. Right, so they all interact to create problems. Prolactin levels, again, are higher in breast cancer. Interestingly, higher lipid levels are correlated with higher prolactin. So again, prolactin is, in my mind, definitely a risk factor. And I check prolactin levels always initially and monitor that if those levels are elevated. So that can be, checked through SpectraCell along with the other hormones. So looking at all these hormones is important. When prolactin's elevated, remember I mentioned vitamin B6, but also maybe sage and Vitex may be helpful in lowering levels. So growth hormone obviously promotes cancer, development, progression, metastasis, angiogenesis, cancer stem cells, and chemotherapy resistance. So sex hormone binding globulin was protective in postmenopausal breast cancer, and postmenopausal breast cancer, higher BMI is associated with higher risk, of course. So SHBG reduced risk of breast cancer 36% in postmenopausal women. Again, it's a normal reaction. It's a healthy reaction of the body to produce SHBG. So if the liver's not working well enough, you're not going to produce enough SHBG. So when you're having higher estrogen levels, that liver needs to churn out that SHBG to reduce the available estrogen to tissues. So higher SHBG associated with increased breast density in this one study. SHBG is inversely associated with C-reactive protein. So by binding up the estrogen, which promotes C-reactive protein, by the way, whenever you give oral estrogen, that will increase C-reactive protein about 85%. So that's true probably for even birth control pills, or whether you give oral Premarin or whether you give oral estradiol. That's going to basically double C-reactive protein and inflammation production. So total testosterone is associated with lower C-reactive protein. So again, estrogen in excess promotes inflammation, and inflammation promotes angiogenesis, growth of blood vessels within tumors, whereas testosterone is anti-inflammatory overall. So that's why aromatase inhibition, whether naturally or with prescriptions, can be protective because it tends to boost testosterone and lower estrogen. However, you don't want to convert that to dihydrotestosterone, which is 5 times stronger than testosterone, because that's a tumor promoter as well. So that's why vitamin D, which kind of blocks those downstream pathways, is important. Zinc blocks those downstream pathways. Turmeric blocks those downstream pathways. They're very important. So testosterone in the study reduced breast cell proliferation, but can convert estrogen through aromatase. Testosterone or testosterone plus an aromatase inhibitor reduced risk of breast cancer and treated hormone deficiency symptoms. But believe me, I would not give testosterone in breast cancer or for prevention. Again, testosterone can convert into estrogen and be problematic. And there are androgen receptors on many breast cancers. So unless you do specific testing for androgen receptors, you don't know whether that's an issue. So there's so many better approaches to consider. Don't use testosterone in that scenario. So women in the highest quartile of free testosterone were associated with lower breast density. The study suggested breast cancer markers CEA, CA125, and CA15-3 can be elevated in breast cancer, so you can consider checking those markers, and particularly in more advanced stages, those markers will tend to be higher. So breastfeeding, as you may realize, is correlated with reduced risk of breast and other estrogen-related cancers. And it's hypothesized that breast sexual stimulation may also be protective because whether breastfeeding or breast sexual stimulation, that's generating oxytocin, which may empty the breast ducts, aiding toxin elimination, reducing breast cancer risk. So I remind my wife of this every night. So oxytocin reduced breast tumors in rodents via nuclear factor kappa beta. So mast cells promote breast tumor growth. Mast cells consistently infiltrate tumors. Mast cells enhance blood and lymphatic vessel formation. A major mast cell component is tryptase, a potent angiogenic factor that's promoting blood vessel growth. And tryptase is correlated with bad prognosis. So histamine promotes tumor cell proliferation and tumor growth. And mast cell depletion reduced mammary tumor size, metastasis, and a murine model. So treating breast cancer as an allergy, may be a good idea. Now, I don't like conventional antihistamines, right? The conventional ones cause neurocognitive impairment. They block the memory transmitter, acetylcholine. But there are a lot of natural ways to support antihistamine. Boswellia, frankincense, is a great natural way to support that. A lot of anti-inflammatory characteristics. Quercetin, the bioflavonoid, that's in apples, onions, and broccoli, is a great way to help dampen histamine. And don't eat leftovers. Food that's left over, the longer it's left over, the higher the histamine content, and therefore that's going to promote tumor activity, this research suggests. So allergies are also associated with leaky gut issues, aren't they, right? Increased intestinal permeability. And so everything you do to prevent intestinal inflammation by avoiding foods that you're sensitive to, everything you do to heal up that leaky gut, increased intestinal permeability. I like to use marshmallow root, and of course probiotic falls in that category. So those things dampen inflammation, which are very favorable to do. So I think that's a good strategy to think about, is treating it as an allergy. So aromatase is higher in postmenopausal breast tissue. It's associated with higher leptin, high sensitive C-reactive protein, adiponectin, HDL, and is higher in inflamed breast tissue as well. So prevention of breast cancer, zinc, remember, blocks aromatase in 5-alpha reductase. Selenium also blocks aromatase, 5-alpha reductase. Magnesium is preventive in blocking aromatase, and theoretically would be favorable. And again, I'm fine with Epsom salt baths or dietary magnesium. Turmeric also has aromatase-like activity and is preventive based on a lot of research that's out there. Also, these nutrients, resveratrol blocks aromatase and also 5-alpha reductase. Chrysin is a good one to use in strongly estrogen-dominant individuals. Passion flower, ashwagandha also block aromatase. So those are, but ashwagandha does increase, testosterone and maybe dihydrotestosterone. So I would not use ashwagandha in breast cancer at this point. I would prefer to use inositol IP6, which dampens both estrogen and dihydrotestosterone. Ashwagandha lowers estrogen, but if there are androgen receptors in the breast cancer, then ashwagandha might be problematic in those scenarios. So I'm not a fan of mammograms. Do they cause more harm than good? And certainly exposing the breast to a lot of radiation. So only 50% accuracy when the breasts are dense. And of course, nearly all breast cancers occur in dense breasts. And if you do a breast ultrasound, that also is 50% accurate. So in dense breasts, mammograms are no more accurate than ultrasound of the breast. And I took my wife down to Knoxville, traveled 150 miles to get breast ultrasound rather than getting mammograms. If you have a tumor that's 2 millimeters in size, that's the size of your pupil, that's when it gets a blood supply. And what happens then when you squish it with a mammogram? I don't think anything good happens out of that. Some of the tumor cells get in the bloodstream, promoting metastasis. I'm very concerned about that. And there's an overdiagnosis of breast cancer, 31%, and only one of 15 early-stage cancers diagnosed on mammography were expected to become advanced without treatment. So breast ultrasound, finally, that's becoming available. Now it's available here locally for me. And incidentally, down in Knoxville, at the Comprehensive Breast Center there, and you may not be near Knoxville, but they're doing cryoablation of early breast tumors. Dr. Zawoski down there is very cutting edge in terms of her management. She also has a CT scan available of the breast that does not compress the breast, so that's an advancement as well. So, of course, there are 3 different types of breast cancer. You want to identify what the types are. An initial support protocol to consider when not contraindicated, inositol, omega-3, 6 with a good omega-6, GLA, not the arachidonic acid, when right, vitamin D, zinc, tocotrienols, coenzyme Q10, alpha-lipoic acid, all are favorable. It appears turmeric, green tea. Green tea is a good hormone modulator as well. Mushrooms do what? They boost testosterone, block estrogen, probiotic, protects against toxins from getting in, reduces inflammation. I like to use rhodiola for fatigue and cancer. That's my top choice. It has anti-VEGF. That means it protects against angiogenesis. And then circulation support is real important initially to protect against heart attack, stroke, thrombophlebitis, and pulmonary emboli. So also consider resveratrol, pterostilbene, boswellia, bromelain, which is a systemic enzyme from pineapple on an empty stomach. That's when you would use bromelain. Actually, let's go through from that recommendation. Metformin derivative is worthwhile, but I've seen some more recent research go through that makes me hesitant about that. Berberine, though, derived from golden seal, and I love to use lots of golden seal for sinus issues. It seems to work almost all the time for sinus congestion. If you use sufficient doses of that. And berberine derived from that lowers blood sugar, protects against angiogenesis and cancer. Research suggests black cumin seed oil. It's in King Tut's tomb. I think King Tut knew what he was doing. And using Nigella sativa, a lot of anti-tumor mechanisms associated with black cumin seed oil. Ellagic acid, for example, and pomegranate are botanicals to consider. And so cautiously address deficiencies, prescription metformin, and then Celebrex, believe it or not, or Aleve, or bigger dose, like a 325 aspirin, helps protect against angiogenesis. And blocking adrenaline, very, very important. Peacefulness, probably the single most important thing. Propranolol has shown a lot of promise, particularly right around the time of surgery, before and after surgery. If you don't have asthma, now don't take propranolol if your patient has asthma, right, because you could kill them by doing so. But otherwise, very helpful. So the important strategies to address, maybe the most important one of all is peacefulness. And getting your patients in a peaceful state, how do you do that? Well, tell them the stories of near-death experiences. I had my 58th near-death patient, spiritual near-death patient today. Her description was just entrancing. So tell your patients the stories of what they describe the other side is like when they come back, how they're not afraid of death anymore, how that the other side is more real than this side. The colors are more vibrant. The music is more vibrant on the other side than on this side. You talk to these patients, it doesn't take you long to realize that Einstein was right, that E equals MC squared. We're just an energy field and not solid mass at all. Circulation, the second most important thing. You don't want to be treating your cancer patient and have them die with a heart attack or stroke or to get thrombophlebitis followed by pulmonary emboli. And it doesn't have to happen. But if you don't quickly initiate treatment to protect against that, and monitoring D-dimer is really important to guard against that. If you don't initiate it, your patient can have that happen. But if you're aggressive with that, I can't, in my 12 years of dealing with cancer, I don't recall a single patient that's had a heart attack or has had a stroke when they've done what I recommended. But I can tell you a number of cases where they have when they've ignored my advice. And same thing with thrombophlebitis. It's largely preventable. We want to optimize nutrition, lifestyle, exercise, very important. You want to go first to an integrative provider, avoid non-essential imaging procedures. You want to fast around chemotherapy before and after. You want to prevent cancer stem cell release. A lot of nutrients help with that. You want to monitor monthly blood work. Always give hope with these patients. So blessings to you. If you have questions, I'll try to answer that. My email is jproach@aol.com. Check out my other websites, drroach.net and vitalstrategiesincancer.com. Some surprises coming out in relation to those sites. So I enjoyed so much the opportunity of presenting to you tonight. Thanks for listening in, and more to come in the future. P.S. There's some bonus slides along with this, so when you get an opportunity, check out the bonus slides.
Thank you, Dr. Roach, for another informative presentation. We are currently out of time for questions. This concludes our 2018 webinar series. We will be back in January 2019. We wish you and your families happy holidays and see you next year.